it's a great turnout. I'm glad you guys are here. I'm gonna do this in two parts. The first part, we'll sort of talk about different arrhythmias, coronary artery disease, and I'm gonna switch it up. No shade to the men in the room. The second part is probably focused on the women and some things that we actually deal with. When we talk about atherosclerotic disease in general, it's essentially cholesterol buildup in the arteries. So I'm a vascular surgeon, and I predominantly deal with blood vessels outside the heart. So really a cardiologist, like the one your father saw, generally focuses on blood vessels in the heart. But as we know, blood travels everywhere. You have blood in your brain, you have blood in your arms, your legs. And I always tell patients, atherosclerosis or plaque buildup doesn't discriminate. And so you can have it in the heart, you can have it in the neck vessels that go to your brain, that can cause a stroke, similar type of process. You can have it in your arm, and that can cause blood clots in the arteries to your hand, where your fingers can turn black. You can have it in your legs, where you have pain with walking. And so the first part will be focused on really atherosclerotic disease and what we can do, especially as a Black community, to help change that, because we are greatly affected. Heart disease is the number one leading cause of death, particularly in Black and African American communities. A lot of it has to do with our, systemic racism. We can talk about the lack of healthcare, lack of education, lack of awareness, but oftentimes just our own traditions, foods that we eat, our own activities, and so forth. And so I'll talk a little bit about that in the beginning, and then we're going to switch it to something totally different. We're going to talk about the veins. I think we focus a lot on the arteries when it comes to heart health, but I think we don't give enough credit to the veins. When you think about the body's circulation, it involves both the arteries, which brings good blood flow with oxygen to our legs and our arms, our brains, but also that blood that has to come back and what that looks like and how it can affect us. And so how many people here know someone with heart disease? How many of us know what the signs and symptoms of heart disease is? Can anyone give me?
I guess when you have a pain in your arm, your left arm.
That's right. And so that's when it's unusual. Happens more often for women. Do we know what the most common sign of a heart attack is for men? That's close. So chest pain is probably very common. Believe it or not, nothing, death. And so, especially in men, and we don't know if that's because men are very stoic, they feel a twinge, oh, it's just heartburn,